Welcome to the In Factor Conversations with Entrepreneurs. I'm Rebecca White, and I am so excited today to have Annette Bosworth with me. She is a physician, advocate, faculty member, entrepreneur, and I think I even saw in her background that she dabbled in politics a little bit. So she's done a little bit of everything, a true slash career woman who's really made a name for herself in the healthcare industry, has recently moved to Tampa, and I am so excited to welcome her to Tampa and to get to know her a little better. Welcome.
Thank you. Thank you, Rebecca. I'm super excited to be on your show and to learn more about the community that I've landed in. Honestly, I had the biggest fear when leaving my 50 years in South Dakota was how do you push reset at 50 when I come from a rich set of relationships and friendships. And it's been so I'm looking forward to this too, just because of people like you in this community are everywhere, but I'm still a quarter turn off of getting into real relationships with them. So it's really nice to be part of this.
Well, as I said before we got started on recording, I'm so excited to welcome you here. And as I read more about, and I'm excited to learn more about you today, but as I've read about your background, as I said to you, you're the kind of doctor I would like to have. So you're an internal medicine physician, and you've done a lot of amazing things. So I'd like to just go back and say, how does a South Dakota girl who grew up on the plains, as you put it, in some of the things written about you, find her way to medicine? What led you there?
Well, I will say, with all honesty, that it was hog chores that got me there. Sometimes you reach for things in life because of what you're going away from, and a little bit about what you're heading toward. And I grew up in a town of 800 people, so K through 12 in one building. You start kindergarten with 21 kids. You graduate 13 years later with the same 21 kids.
Wow. Wow.
People, when you look at rural and you look at how difficult small town vitality is to keep, I think it is difficult for those that don't come from that to really understand. There's this attraction that people have. This, Laura Ingalls Wilder. If you ever saw,
Little House on the Prairie. Yes, yes.
That was South Dakota. This is small town USA. Pioneer people who are brave and take on the weather, and they do things because if you don't do it, it doesn't get done. And that idyllic lifestyle, well, it has a backside. It has a side that I grew up thinking, I don't want to be a farmer's wife.
So there are hogs out there, right? That
And my dad was a hog farmer. I castrated hogs for the first 10 years of my life, probably longer, but at least for the first 10, and knew that there had to be a better way. There had to be a better way than this.
So I love that because we actually have a lot more in common than you might think. Because I grew up in a small town too, in West Virginia, and it's a completely different lifestyle. I agree with you. And now my mom was an entrepreneur. Did you have your father was a farmer, so he was an entrepreneur, right? And and was that part of your inspiration that led you to kind of want to be, even though you're a physician, self-employed? I mean, how did all that happen?
Well, I'll tell you that I didn't know the word then.
I didn't either. My mom just owned a business. That's all I knew.
Right. Well, my mother ran for a county auditor. That's the first job that I saw her get after raising us. But when I was young, she had gone to school for being a registered technician of X-ray. And so she'd been in a medical world, but you're in the middle of nowhere where the drive to the closest job is over 30 miles away. And in 1971, that's a long ways away. But as she did her beginning life, stayed at that for a little while, but then said, you know what, with 3 kids, I belong here. As soon as that was a little more stable, she said, I can't I need something. I need more. And so she ran for an office in our county, called, she was the assistant to the auditor. And that began a journey where she then ran for office herself and became the county auditor. So she was leading her own way. And I know that was a big part of what said, I can do this. I can be that independent when you are born into a farming family. As strange as this conversation might sound in 2024, I mean, my dad prayed for boys. And he had me. And so the next baby was a boy, but he was born very premature. There was actually twins, and one died. And so for the longest time, I was in a place where acting like the strong, do what dad wants, have that drive to get things done, figure out problems without having to be told. So there was this mentality, I think, that happens in most rural communities, especially if you're a farm kid, that you don't have an electrician come for everything, you don't have a plumber come for everything, you don't, or you would never be able to afford it. And so there's this mindset that you solve problems as you go through life. And that was a really strong product of what my dad exampled for me. And my mom, on the other side, was much more involved in our church and our community, and then the leadership in the political side of things for running for office. She showed me that if you don't show up and do things, your community doesn't have it. That if you didn't go out for the basketball team, there wasn't a basketball team. It took 5 girls to go out for the basketball team, and I was the 5th one. I was not good at basketball, but I went out because the other girls really wanted to play basketball. So that kind of mentality of, you don't have community meals on wheels in a small town. You have ladies that go to your church and volunteer to do that for the elders in your community. And if you don't show up and do it, it doesn't exist. So I just think that heart of service that doesn't keep score was very, very much a part of, this is what you do. There wasn't an option not to. That's just what you did.
Yeah, which is a big part of entrepreneurship, that the whole taking ownership, right? Because, when I first started teaching entrepreneurship, it was in Cincinnati, where we had a lot of corporate headquarters. And I can remember that the organizations for the graduate students their companies would not pay for an entrepreneurship class. But it wasn't too many years later, because they were afraid they were going to lose them. But it was not there was not a few minutes. It wasn't much later that those companies realized that having employees who take ownership, which is what you're talking about, makes for a better employee. So,
right.
yeah.
Yeah. I can think of, as I was going through training and saying, okay, I'm going to, drive to find a job that doesn't land me back in my little town. And, the years it took to do that. And I kept reaching for what I thought was the right thing it's what everybody was reaching for, a safe job that paid well in a world where medicine was changing a whole bunch. You were going from lots of independent clinics to almost everybody had been part of a corporation. And if your electronic medical record didn't work, then you were nothing. There was these rules that were all shifting as we were all coming of age inside medicine. So you wanted the job that was secure. And I remember getting to one of the first jobs and thinking, oh, there's a whole bunch of problems here that need to be solved. And that ownership of the problem, it turned into leadership. That if you're going to be in a company where there's lots of people just like you with lots, medical degrees all the way up and down the aisles, but there were these problems that, why is it so hard to get a urinary tract infection treated by a woman who's had it, 4 times in the last 2 years, and now you're making her wait a week to come see me or go to the ER? There's a way better way to solve that. And I think that same sense of, if you don't solve it, nobody's going to do that. That ownership part really did come as it must be part of my soul from being. No, I don't know.
Well, you went to college, obviously, and you chose a career path in medicine, and you've been an entrepreneur. Let's back up a little bit. What led you to college? Because not every girl from a small town goes to college. So how did that happen, and how did you choose medicine? How and why?
Yeah, that's so bizarre. Okay. So the truth is, I didn't want to be a farmer's wife, and I had this mantra my dad would say to especially his daughters: I will give you an education, but I won't give you away. Meaning, I'll pay for college, but I'm not going to pay for your wedding. So good priority setting. I see where he was going. And this all worked out well, unless you look at the hog market in 1990, which is when I graduated, actually 1989 and 90, which is when I graduated from high school. And the hog market it just fell out. I mean, I've never seen my parents so desperate to pay bills. We weren't wealthy. We were a small little farm, but we had a lot of our life vested in the hog market, and it just went to pot. It went to pot. So all of the things that were saved for my college education they were gone. I can remember my dad sitting on the edge of my bed saying that money I had saved is gone. And I was definitely terrified. At this point, I had whispered the words that I wanted to be a doctor because of a school assembly. That's a word used in a small town when K through 12
Sure.
building, where everybody comes to listen to somebody speak. Now, I don't know if everybody was there, but at least I was in the 7th grade. And so it was at least 7th grade to seniors in high school were in front of these two, they were the Addams family. And it was two kids that I knew from Sunday school. They were much bigger than me, and they'd left, and now they were back, and they were giving the assembly because they were back from college. They were about a year apart and had gone to one of the universities in South Dakota, and they were talking about how to choose a college, why college is, what it has for a path, and for sororities and fraternities, and how you network. And so they give this little presentation, and then they ask questions, and I was listening, and I'm like seventh grade in the front row, raise my hand as high as I can. And they said, what's your question? I'm like, well, what's your job? And the two of them looked at each other. I can be being really nervous because they looked at each other. You could see them flush, and they had taken up studying music. One was a trombone player and played in the church all the time. I knew they were a trombone. I knew this was their skill set, but they had gone through it. They had done this thing called college, and they didn't have a job. And at this point, I was riding my bike to and from school. So it's a long country road on a bike. And I can remember being so upset on the bike ride home that the equation for college did not lead to job. And I'm at the end of our driveway, which is about a half a mile long, and I pick up the mail, and on the front of Time magazine, it said job placement and satisfaction. And I can remember riding my bike with no hands down a gravel road, reading this chart that says, if you studied in medicine, you had like a 95% chance that you were going to like what you did or get a job, and that you were going to like what you did. And so that night I said, I'm going to be a doctor. Dad looks and says, what? And my mother's like, okay. What's it take to be a doctor? Don't shut up.
I love that story. So, isn't it amazing how these tiny little things can be put in our life? The serendipity of it almost. And if you hadn't picked that up and read that, where would you be today? Maybe you'd still be in the same place.
Truly.
But it's you didn't have role models in your family, in other words, who were physicians.
I hadn't met a doctor. I got all my vaccinations from the county nurse. I didn't ever go to the doctor. I knew that was somebody that had a pretty good job, and you had to study really hard. So I've actually said to young women, like, you should actually meet people in your profession before you decide that's what you want to be.
So when you were in college, did you ever find yourself at a point where you were like, oh, this was a mistake, I shouldn't have done this, and almost turn around? Obviously you didn't, but almost.
I'll tell you, my dad said, all right, you think you want to be a doctor. I think you should be around some examples of medicine. And so the closest thing that I could do in high school, between my junior year and my senior year and freshman of high school, I was a nurse's aide in a nursing home that was about 25 miles away. And I rode with this little old lady who'd been a nurse's aide for 40 years. That's all she'd been. And she was my ride. I did the same shifts as her. That's how I got to and from. And then my dad said, if you can find pleasure in serving at that level in medicine, I'm sure you can find pleasure in serving in as your rank goes up and your knowledge goes up. So it was a good advice. I learned that dentures are a disgusting thing I never want to own. Teeth care is really important. That was like my whole job all summer long was that. But then I transferred that skill to, there was a emergency room and nursing home and emergency room connected together in that college town, where I showed up for a couple of shifts a week. And then that turned into summer jobs where I was a nurse's aide, and I would work in a nursing home and would be able to cross train over in a hospital, which is where I actually got to meet physicians and see what they did and saw what their skill sets were. And I mean, you're a shadow to them. You're kind of in the background, but I found that their influence on me was way bigger than they know it was. And that I've tried to appreciate that there is somebody 3 layers behind the leader that is still watching, and that that professionalism and that ability to example how hard the job can be and the grace you have for yourself and others, it ripples through a community, through an organization, and especially a care team in medicine. So that's actually where I said, well, I think I know what I want to be when I grow up. Let's see if I can do that. And in the process, I'm trying to navigate. You show up to biology 101 and the professor says, how many of you want to go to medical school? And the whole room of 1,000 students raise their hands. He says, 2 of you will make it into the medical school statistically. And I couldn't believe that. I'm like, oh my goodness, this competition is really hard. So I got a 4.0. I'm like, okay, let's game on. I do not want to end up back in that hog barn. And I can remember sitting in the library, and as soon as I would hear my friends would say, let's go. I'm like, this smell in my nose would haunt me saying, I'm going to put in a couple more hours. I'll meet you there.
Meaning, don't give up. Right. Don't give up.
And it is a journey. It's a heck of a journey.
Yeah. Mm-hmm. And there's so many things in that story I love, and I think the one thing I want to pull out is this life of service that you've chosen, because it goes all the way back to what you were talking about with your community, showing up, being part of a community of people, caring about the people around you, and your whole career has been about that. Let's go back. So you got out of med school. I know it's a lengthy journey. I had a lot of graduate school as well. And so when you got out, tell me how you started. How did you start your career?
Well, so I originally thought I was going to be the kind of doctor that ran an ICU and had intubated patients with calculatable answers because they were either right or wrong. And that
black and white, it's a lot simpler, isn't it?
Would not be true. Well, it turns out that's not what happens in an ICU, but it looked that way from my point of view when I was trying to pick which kind of doctor do you want to be. And I took my mom 7 years to get pregnant. So I'm married, and I tell my husband, I think I should go off the pill. I think we should, be prepared, but it's going to take a while. And a month later, I don't feel good. I'm still in residency. This is before they had hours in residency. I'm putting in like 120 hours a week, and I'm pregnant. And anyway, so I have this baby in residency, and I had still been vying for this very competitive place in ICU medicine, or what's called intensive care, pulmonary fellowships. And I held this baby in my hands and said, honey, I don't think I want to do that. I think I want to just be an outpatient physician with a clinic and come home at night and do this. And I have no regrets about doing that. But my husband did say, you're changing one of the most lucrative paths in medicine for one of the least lucrative paths in medicine. And we still have the same student loan bill. So he was being funny, but also knew that I wasn't going to let that other major job in life, which is raising my family, be something that was, I just think that role has served me well, not in just showing what acts of service look like to my staff mates, the medical students that I've mentored, but also my kids, to say, you can do a really well-educated job and you can balance it in a way where my role as a wife and a mom has also blended well with these acts of service, because I was well trained and had this other skill set.
Yeah. I love that message too. Once again, we have a lot in common, because I got pregnant during my PhD program. I had 2 little ones before I graduated. I had to slow down the process. And I can remember that I wrote my dissertation from like 4 a.m. till 6 a.m. because they weren't up yet. So it was either then or it was late at night. And by night I was too far gone. So. Right. So, I think that's an important message.
Mhm.
But it's not easy, and there are lots of sacrifices along the way, and I know that, and I know you made a lot of sacrifices to get where you are. So
Yeah.
you decided to, did you go into practice with
Yeah,
physicians?
it turns out when you're going to be an internal medicine doctor and do primary care, there were a lot of people who wanted you to do it. So the job options were pretty amazing. We decided not to move. Like, we were in Salt Lake City, Utah at the time, and I really loved the mentorships that I had created there. I got really attached to the medical community and thought, I don't feel like I can walk away from these relationships because I don't think I've learned enough. And I know if you go to another medical community, those relationships are difficult to foster as a brand new graduate. You sacrifice. So I stayed there for another several years, and I augmented my 4 days a week at the clinic with one weekend a month in a little town about 100 miles from anywhere, where I ran the emergency room. So I got to blend what I thought was, you can call it frontier medicine because you're the only one around, but also just really good skill set for that thing I like to do, which was, you're in the middle of nowhere, you're on a farm, and the plumbing doesn't work, and now you got to figure it out. So
Mm-hmm.
you call somebody, and you've got to be able to think and solve this problem without all of the resources, but enough of the resources. I loved it. I loved those weekends in Fillmore, Utah for several years, and it was, I think it really blended well for where I was headed. My mother then calls one, the other part of that story I think that's helpful to weave in is when you don't have a lot of mentors in medicine, you get to this special place in about the third year of your medical school training, and they say, well, what kind of doctor do you want to be? And I was like, oh my Lord, another major life decision about something I hardly know. I mean, I know a handful of each types of these doctors that you want me to pick what I'm going to be. And so I chose internal medicine because as I was answering the questions that my parents would have, the people who fed me the answers that my parents liked the best were the internal medicine doctors. They said they seemed to know the answers deeper. And I felt satisfied in a way that the one day I can remember my dad actually believing I was a doctor was when I answered a question so thoroughly in a way he totally understood. It was a major rite of passage for me where he's like, oh my God, you're actually a doctor. Anyway, so I took this internal medicine training, and my mother had called me from a hospital bed in a little town, the same little town where she was the x-ray tech, 30 miles from our farm. And the pathologist dialed me directly to say it's cancer. And I hung up the phone and said, Chad, we're moving home. He was the oldest born. I'm the oldest born. And there's just something about that, right, where your parents get sick. And
Sure.
not only is that illness something I need to be close for, but I'm a doctor. So they'd been recruiting me back to South Dakota for a long time by now. And I said yes. So we headed back to South Dakota, and I leave one corporation and I go to another corporation. And I'll tell you, Rebecca, it might be the biggest lesson ever for saying companies have a culture. Companies have a place where they honor certain characteristics and they scold certain characteristics. And the leadership in that organization that I had been assigned to had some major turnover, and the problem solving side of my brain that I think is definitely deep, it's part of who I want to be. That was not a welcome place for that environment. You did what everybody else did. You did not. You've only been here a year. You don't have the answers. Quit trying to lead. Stop doing that. You're disrupting things. You're not doing it like everybody else. And it was just one bloody nose after the next, where I finally said to my husband, I can't do it. And I can remember that week in church, I had never given up on anything ever in my whole life. And I had told him, I give up. I give up. And they were passing around, it's 2010, they were passing around a clipboard to volunteer for the Haitian, in Haiti for that Haitian.
The earthquake. Yeah. Yeah.
And he signs us up without asking me. And the next day, I'm this little old lady with blue curlers and an accent says, this form says that you're a doctor and we need some of you for this disaster going on in Haiti. and I am not in my right mind. I'm very down. I mean, probably officially depressed because it was such a sad place in my personal life, saying, why couldn't I make that work? And I said, lady, I don't even know where Haiti is. She goes, well, what kind of a doctor are you? I'm like, a good one, but I can't do this. And she said, well, I need you to pray to God. I'm going to call you tomorrow and ask again. And she hung up. But I was so mad. I had every little line. I was going to tell her this is exactly. And if you've ever had a moment where you just can't say something, she's talking to me the next day and I'm ready to fight with her. And there was I don't know, something took over my own vocal cords. And I said yes when I wanted to say no. And I end up in Haiti, in a place where the devastation and disaster was, well, it was like the disappointment I felt in myself for not being able to do this job in an environment that, I mean, I clearly didn't belong in that environment. It was not going to be the best use of my skills and talents, but I couldn't see it from that point of view. And I showed up in Haiti and I did service. It was service. It was a part of medicine I was missing, that it was solving a problem, figuring it out. And I left there more alive than I'd been since I'd moved to South Dakota. And I told my husband, I could have done so much better had I been prepared. Let's go back. And 5 weeks later, we went back and took another crew, and it became this. I think we went to Haiti over 30 times, taking medical students, doing service, taking our kids to say, you can take a blood pressure, you can write it down. You might be 8, but you can do this. You can learn how to serve people too. And it was in a place where I awoke and my soul was alive again. It was really a tough, I probably haven't ever explained how devastating it was for me to not succeed at something I was trying my hardest at. And I don't think, obviously God didn't want me to succeed there. He wanted a different plan. And that was the first time where I said, I don't know how to run a clinic. I don't know how to be a doctor. And so, but I started and I said, okay, let's solve these problems. Let's figure out how to solve one of these problems at a time. And thankfully, when you work for a corporation, I had signed a non-disclosure, a non-compete, excuse me.
Yeah.
And they came to me and said, well, you're no longer part of our organization, but you also can't work within 20 miles of our advertising. In South Dakota, 20 miles from one of their advertisements was like a cow pasture. I mean, there was no population there. And I said, there's got to be a better way to do this. I just moved 3 kids and a family across the country 2 years ago for a mother who's fighting cancer. I'm not going to move. And so a whole bunch of shiny shoes left the room, and they came back in and said, okay, you can see Medicaid and the homeless for 2 years. And so I found a shelter that had a room where I, paid a little rent and set up a very slow building, not a lot of money, but it was great. It was great. It was like the best feeling of freedom that says, I don't know how to do all this, but I am really good at figuring it out, and I will figure it out. And that became a place where I saw a whole bunch of brown kids in a white community, meaning there was a lot of Native Americans in those shelters, and they needed a good doctor, and I needed somebody to serve. And so it was the perfect marriage. And I found my business.
Wow. What a story. And again, so many things in there. I'd love to talk about the value so first of all, someone like you who succeeded at everything that you've tried to do pretty much through like hard work, right? You put your head down and you figure it out.
Right.
And then you get to that thing that you just can't push through. And it's like the boulder, right? And you've got to go around it, but it's so hard to give that up because it's like you lose something in yourself. But when you gave up some of that self and focused on other people, that's when you were able to find really your passion and your purpose. And what a great story. So many of the listeners to this podcast are, young people who are trying to find their passion. You know, a lot of my students say to me, everybody tells me to follow my passion, but I have no idea what it is. And I'm like, that's okay. Just go do something, because
Mhm.
your passion, you'll find it, it will find you. But you kind of have to let go and trust in that system.
Oh,
And
absolutely.
what a, yeah, what a
I
great
mean,
story. I love it. And so you came back, you were in your small community. And I just have to ask, is your husband a physician also? No. So
nope.
but he was willing, it's a reminder of the importance of families and partnerships, especially for entrepreneurs. Sometimes it's really hard on family members too.
Yeah, my husband his family comes from a legacy of salesmen and entrepreneurs. He had that word in my head long before I would ever have called myself that. Even after I had my own clinic, I wouldn't have used that word. That was not me. That was something his family did. Or but you get around that mentality of other people solving problems and the freedom of saying, huh, the world just changed and we are able to adapt, as opposed to what was happening inside that corporation that I was really frustrated with. And they were frustrated too. They were trying to solve it. When you back up and see, it wasn't me, it was this organization that was doing these old style things when medicine was changing and the bills weren't going to get paid the same way. They had to change. I just happened to be at a time where it was really easy to say, well, it must be that problem. That must be the problem. And you then get away from that and look at other people saying, wow, there's only 5 of them in that little company, but they just solved a problem that everybody needed an answer to, and they did it in a quick way that did not have a lot of bureaucracy. So does that mean you have to be small in order to be an entrepreneur? And this is where I don't think that's true, but I do think it's really hard to take young students and say, yeah, you don't have the skill set to be an entrepreneur from step one. Nobody's going to give you capital money when you haven't had a few more trips around the sun and a few failures, a few tries and failures. But that means the path you're on needs to have that mindset of take ownership, solve a problem, take ownership, solve a problem. Yeah.
Absolutely. And keep going, right? In my book, which you said that you bought, which I'm thrilled about, See, Do, Repeat,
Yeah.
that's that simple formula. It sounds really simple. It's hard, but it is about seeing opportunities and taking ownership and action, and then just continuing past failure and obstacles along the way. And I know you've had your share. So let's go. You've started, you had this non-compete, which many of our listeners probably at one point or another, if they haven't already, may have, and they may have to be creative. And I think there's a lesson in that, because usually the problems we're presented with are where our most creative solutions come from.
Mm-hmm.
So you had a creative solution and you started a clinic, basically, right? Your own clinic. So that was your step into entrepreneurship there in small town in
Yeah.
South Dakota.
Right.
Yeah.
And I think the best part that probably helped when you leave this kind of I mean, it sounds like such an overwhelming thing to do. Start your own medical clinic. I mean, in today's world, you got to have billing and you got to know how to computer programming. And I mean, it is a Goliath of a job. But I think what was more luck probably than anything was I had this niche. I have people that couldn't pay me, and then I had Medicaid. I had very narrow window for 2 years to say, let's
Yeah.
figure out this audience. And then we're going to add the next ones. And then we're going to add the next ones. And
Yeah.
I think that kind of stepwise in any problem solving is just don't take the whole elephant in with one bite. You need to really say, find what it is that is going to be part of your service. Like the hardest part about the way I started was, I mean, there's a reason that most clinics that serve Medicaid are subsidized by the government because the margins are super
You can't
slim.
make money. Yeah.
You're like, I don't know how you have one thing go wrong and you don't get paid for 6 months. You get investigated by a Medicaid. It's the only people you're seeing. Well, something went wrong. That's called an investigation. If you're investigated by Medicaid, nobody pays you for 18 months.
Wow.
That's a lesson. I mean, so that process of becoming an entrepreneur had lots of failures in the beginning, but it was at a scale that was slowly rising. That, I mean, thank God my husband had had his life and his business that was going well at the time.
Yeah, yeah.
Couldn't have gotten
But
through that learning curve.
But there is such, I mean, I'm so glad you brought it up because that is, that there's such a great lesson in that because we have to test everything that we're doing. And there's lots of, one of my favorite sayings for my students, of course, you weren't quite there yet, but the riches are in the niches. So, finding a niche and doing something on a small scale is absolutely the way to go.
Absolutely.
And it's so much easier now even than it was back then. Of course, we're talking about healthcare, which is for most of us who are not in it, maybe even for a lot of people who are in it, it's a real challenging maze to
Oh,
figure your way through healthcare and insurance and just as you pointed out, sometimes waiting for a doctor
oh.
for months. It's
Uh,
just really
I'll give you an
challenging.
example of how that the next. So as I'm learning and failing, and then figuring out how to get a little better and a little better and a little better, um, I mean, I come from this pulmonary medicine ICU training and then was really good at how do we take a broken brain and get it to peak performance. That was really, there's lots of things internists do, but that's really I'm bread and butter. I do high blood pressure, cholesterol, diabetes, thyroid problems, cancer, all of that. I don't catch babies. I don't do surgery. But what I love is when the brain isn't working, how do we get peak performance out of it? And whether we're talking about somebody with Parkinson's or bipolar or not sleeping well or a head injury, that is where I really enjoyed the puzzle, the solve. So as I am trying to on my own, little clinic, you can't spend a lot of time with each patient if you're going to pay the secretary. It's
Right.
not some office manager telling you you need to shorten up the times that you see the patient. You actually can't make payroll if you do that too much. So I had this process where the first step that you must do when healing any brain injury is you have to fix their sleep. Their sleep habit, that's where the brain heals. That's where you cannot be drinking yourself to sleep. You cannot be taking those sleeping medications and ask me to fix your brain. And so there were some steps that had to be done before we could start the treatment protocol that was going to improve their brain. And when a patient comes to see you 3 times and the only appointment they can get is about every 6 weeks, and the first step you have is, here's what we're doing for your sleep. I need you to work on these things. Come back and show me your sleep schedule. And 6 weeks later, they come and they do not remember the conversation that you had the last time. Mm. And then they come again and you did it again. So now I'm frustrated. I'm having this third conversation with a person whose brain is so broken they can't remember what I told them. And now they're, doc, I've seen you 3 times. Why aren't you taking care of these other things? So I said, okay, I'm going to do something that I hadn't seen anybody else do. Maybe it was happening, but I just hadn't seen it. It's 2012 and I have the brain lecture, the sleep lecture that I need them to watch. And I film it on a Sunday and I put it on YouTube. And in that hour-long discussion with sleep, I make a handout like you would in the 3rd grade where you fill in the blanks to say, what did I say? And that now I'm saying, all right, before I see you again, you've got to go watch this video that's on YouTube. And here's the handout. If you lose it, you can print it out, but I need you to fill this out. And if you come to the next appointment and you have not watched that video, you're going to sit in the front room and watch the dang video so that you can learn what I need you to know for us to get to the next step. And that process was, well, it's the beginning of the second company, which was the first time I said, the medical information I have, how do I get it into the minds of patients outside of the exam room? Because nobody's paying for the education of what I would give a person. And I think, I haven't looked in the last month, but I think we were at over 500,000 subscribers for our YouTube channel, which is, again, a niche that was solving a problem in the first company that led to the second company.
Yeah, yeah. Now, what's the name of the second company? The
Dr. Boz.
That's the Dr. Boz Company. Okay.
Yes.
And Dr. Boz is your YouTube channel and your educational material online and
A couple of
most
books. Yep.
And your books, yes, yes, because I remember you're an author. Yes, yes.
Yeah.
And so you actually, again, great lesson, took problems that you had, turned them into an opportunity. So you found your opportunities in a problem,
Right.
basically.
Yeah. And I didn't think that was, I mean, I put that out there. I just left it alone. And the next thing I look, about 6 months later, I was sending patients. So I thought like there'd be a few dozen patients that had watched that video. And it was like 500,000 people had watched this video and shared it with other people. And you're like, huh, maybe it was 100,000. I don't know. It was a lot of people, like more than I was ever going to reach in a clinic. And there was no monetization then. This was just me saying, I need to solve this problem in a way that's not getting me so frustrated and get the patients to the next step. So I think that's to me what entrepreneurship is too. You're looking at, you know, people say, where's my passion? Where's my passion? Sometimes passion is connected to the place where you feel the greatest frustration or pain. And you're
Right,
looking for
right.
something to say, this is stupid. Why is this so hard? Why can't this be easier? And that's really where I like, okay, how would I solve this? How could I possibly fix this problem that I am super frustrated about? And lo and behold, a few years later, it's a YouTube show, it's a
Yeah, I
YouTube.
love it. I love it. And I think that's happened probably for a lot of entrepreneurially minded people. It's solving a problem
Mhm.
that you find your opportunity. So I just have to ask you, because healthcare has so many problems, that there isn't any lack of opportunity for entrepreneurs in the healthcare space. And so I'd love to have you talk a little bit about how it's been being an entrepreneur in this space, because I know there's sort of sometimes this conflict between, business and medicine, and, you've got insurance on one side, you've got doctors, you've got the patient. It's very complex. And people are not necessarily being served any better through this complexity. In fact, it's probably gone a long way from the days when, I can remember in my little small town, there was one doctor there and they took care of pretty much everything. Now, did they know everything? Not necessarily, but they had a great bedside manner, which, you brought up you brought up the issue of not even being able to spend enough time with your patients that you could talk to them and
Oh,
hear.
yeah.
Because I had a friend who was an emergency room doctor, and he always said, my patients will tell me what's wrong if I give them a chance and listen.
Yeah.
And, but there's not that time now. So I'd love to hear you talk a little bit about the healthcare system and what it's like to be an entrepreneur in that space, and maybe, where you think we can
Yeah.
have
So
opportunities for
it,
any of our listeners who are in that space, maybe.
So let me share some of the pain that's come with that whole journey. So internal medicine, we take care of, we start at puberty, we take them to the grave. So as patients age, especially as they become subsidized by government paid insurance, it comes with a lot of rules. So let's take the average internal medicine patient has at least 15 medical problems. Most of the medical problems are not acute, meaning they're not going to be gone in 6 weeks. They're going to be here, visit after visit after visit. For that, there are government rules that say I can see that patient every 12 weeks for a chronic problem. That's 4 times a year for that problem. That if I want to see them sooner than that, it has to be an acute problem within the chronic problem, and you have to document that or you won't get paid. Or you can do it that you take care of these 4 chronic problems today, come back to see me in 4 weeks, we'll take care of these 4 chronic problems the next time. Now, don't talk about the original chronic problems because the government's only paying for these other 4 chronic problems. And then you can get to now you've only gone through 8 problems. You've got at least another 8 left in most people. And God forbid you've changed medications in the last 2 visits because you can't follow up on that at the time because that's the wrong problem. I'm pointing out the complexity that when you're trying to take care of humans, you've had these policymakers that, well, they've done some things that really just handcuff physicians. And so, unfortunately, what physicians have done is they've compartmentalized the body. Oh, that's a gut problem. See that doctor. Oh, that's a brain problem. Oh, that's not that kind of brain problem. See that brain doctor, not that brain doctor. They're not going to take care of the same brain things. Oh, that's a heart problem. See that doctor. Oh, I mean, it's absurd. And then to have a patient try to navigate a system that is so compartmentalized you had to start with medical school to understand what we're talking about as far as where they're going. And then to know that they're not going to get satisfied without this proficiency of understanding how the system is built and how it is built. Wow. Okay. So the profoundness of the problem, you don't need me to be the one to tell you that there's a problem. But I'll tell you where I think, where again, the frustration is easy to see. But when you say, how could I solve it? And to me, one of the most dangerous things that's happened is how patients have, well, let me just play a game. When you hear the word HIPAA, what do you think of?
I think of all the papers I have to sign when I go to the doctor.
Right. And then what happens with your privacy?
It gets, I mean, it's supposed to, I guess it's supposed to keep it private, but it gets put into a big
Right.
database somewhere.
Right.
And
So
who knows what happens when that gets hacked.
well, I'll tell you what, most patients, they have that similar thing. That's a bunch of paperwork, and it's about being secret about your problems.
Yeah.
And that you're right, they're your problems. But that doesn't mean you should be secret about them. It does mean that if you're trying to teach people about medical problems, teaching them one-on-one behind the exam room door is the worst way to teach them. First of all, they're defensive. They can't see into their own pain and suffering and setbacks and advances. They usually are going to need to see somebody else with that same problem, watch their behavior and say, oh yeah, I got that too. Meaning the way the human mind works is we mirror information and problems and solutions from other people. And when you take care of medical problems, and I have to re-educate them from 0 to 1 every single visit because they have no community that they can talk about this problem with amongst themselves, do a bunch of cross-learning that comes from, educated nurses or educated people, educated parents. That missing component of the community is missing in these medical problems that, to me, you find lonely patients who are taking a bunch of medications, who don't ask enough questions, and they feel stuck.
Yeah. So you're saying that the patient feels more isolated through all of this.
Mm-hmm. So I'll tell you where that problem landed smack dab. And I didn't see this problem until I started solving it. I'm like, I do is like every other doctor. It's HIPAA. I can't talk to them. You can talk to them. But no, they wouldn't. They didn't have the proficiency they kept their problem secret. And so it was between you and the patient. And there was just not enough space for them to really enrich how they solved this problem with me. So I wrote this book and it was a book on one of the most stubborn patients I'd ever taken care of who'd had chemo twice, had really done a terrible thing to her brain, that it wasn't working right. And she comes to ask me a question that I've been asked lots of times. And many times I don't tell them the truth. I told them what they wanted to hear. And the question was, Doc, if it was you, what would you do? And the patient's cancer was growing rampantly. Chemotherapy is what was recommended by all the textbooks. But the last 2 times, the chemotherapy just took her brain offline for 6 months. Like she was a zombie for 6 months. And the patient was my mom. And I said, Mom, I'll show you what I would do. And we did something completely rogue. We went on a ketogenic diet for 6 weeks. And the cancer at 6 weeks, her outcome was better than any chemotherapy was predicting. It blew my mind what happened in that story. So I thought 12 people would read that book because I lost a bet to my husband. I wrote the book because he said, you should write a book. You should write a book.
In your spare time, right?
That's exactly what I said. And I lost the bet. I wrote the book and people loved it. And now I've got people calling in to become my patient. So much that my staff is ready to go on. They're ready to strike. Like, if you add one more patient to this docket, we cannot see anymore. We are so full. We are so backed up. We got to hire in order to see more at this point. And so I'm trying to do the mom thing. And I'm at middle school picking up my son from middle school in the middle of December. And this woman takes my book and she smashes it into my frozen windshield while I'm in line and she looks around and said, did you write this book? And I'm looking at this woman going, do I know you? I know the whole state of South Dakota, but I don't think I know her. And I couldn't roll down the windows because they're frozen. So I said, well, get in. So she sits in the front seat of my car and she proceeds to tell me that she's read my book. She wants to do this. She cannot get into my clinic. and I'm pushing back saying, well, who's your doctor? I know your doctors. They're good doctors. You do not need to see me to do this book. You can just read the book. And she's arguing with me and she says, well, then you need to teach a class on this and I'll be your first student. And it was one of those moments again where I couldn't say no. Like, oh, that's probably a good idea. I said, all right, I'll teach, I'll do it. I'll have a support group. You can come ask me questions and here's what we're going to do. And I start what is a support group, answering questions for patients as they come in a community led by a physician, but it doesn't have to be led by a physician, led by discuss these medical problems. And I started that group in 20, and I still do it here in Tampa. My office is right next to the pin chasers or the bowling alley.
Mm-hmm.
So I rent the birthday room at 8:00 every Tuesday morning and have a support group where they come and ask me questions. And I will tell you, Rebecca, it's the best medicine I've done since Haiti.
I love it. I love it. And you're building, you're not just scaling what you would say to one patient, for example, which is wonderful that you're able to do that, scale that to many, but they're building a community with each other. That's probably.
Yes. And I mean, the number of frustrations behind that, come see me every 12 weeks for that medical problem so that I can bill the government for the next medical problem. Like that solution was, y'all have the same problems. If you talk about what you're doing and how to improve this, Google does answer a lot of them that I don't have to do it inside the exam room. But more importantly, when you get stuck, isn't it great that I could help you with that lift to the next little level as a community instead of as one-on-one?
Yeah. Yeah. And that's powerful because people can get together. They can do Dr. Google. And I want to ask about that in a minute. But having an expert there, an actual physician because things can get misinterpreted. And I guess that was one thing I wanted to ask you about, because I know I have that weakness. If I have any problem, it's really easy to go and say, okay, what's this stubby cake mean? What's this, and then you just start reading and you can go down that hole of, the Google search hole of, medicine. So what are your thoughts on that? I mean, do you want your patients to get out there and do their own research? And are there any, issues or challenges that it creates for you?
Well, it's like anything. There's two sides to that, right? But maybe I hang around weird doctors, but the doctors that I hang around with are so relieved when the patient wants to have responsibility and and takes initiative to say, even if you Googled the wrong thing, I feel relief when people said, yes, I want to find an answer. So I tried myself. And then you say, well, where did they go wrong? Okay, well, so there are some credible things and versus not credible. Okay, yeah, that's pretty easy to find. And each algorithm that's come out over the last, every 4 or 5 years, you really, I don't Google a lot of things until I watch what my patients are Googling. And then you're like, oh, wow, they're doing a lot better job at this. And they really are. I mean, yes, it can be misinterpreted, but I think that process of the victim mentality that I have this problem and I need to wait for these precious 20 minutes or 40 minutes that you get with the physician. And in those 40 minutes, I'm supposed to capture the social settings that you're under, the sleep, that you had last night, the lab data that is showing me where you're off, the amount of calculations that you need to put in your brain for pattern recognition as a physician. There's no way you're going to satisfy that patient. And unfortunately, I think the next downside has been the compartmentalization. Well, I understand your socioeconomic and your biological and your relational, and that you're going through divorce, and so I understand this part of you. Now go to the cardiologist and have him manipulate your blood pressure, because he's not going to take time for that. He's the specialist. He just does his organ. I mean, there's one thing about a small town is that you did know everybody's family tree and where it forked and where that guy was sleeping with a neighbor and the preacher's wife was doing this other thing that she wasn't supposed to. I mean, all the things that happen, which is called gossip in a small town. And you can look at that in a negative light. But you can also say that it was a community that you could have an appreciation for why that family is struggling, what's going on, and have the grace that during a season where you should just hold off in your judgments, what they've gone through is a lot, and they're not making perfect decisions, but I don't know that any of us would. And having that community understanding of them, I mean, it shifts how I see every patient going through a slump, a season that's not so hot.
Yeah. Yeah.
And
Yeah. So no, I think that is so insightful. And what I hear you saying is that it's when physicians can take a true holistic approach,
mhm.
it's completely different because I mean we all know that our bodies and our minds, it's all connected
Oh
in
yeah,
there, right? I know my mom's no longer with me, but she when she was going through her later years and I was helping her through that, there were so many, one medication could lead to another problem. And if you're compartmentalized, you can miss that.
it's real.
And
And so, yeah, when you say how does medicine find the entrepreneurship, uh, how do you find a way through it? Because the problems are, and it is a broken system. There's nobody that you would talk to today that say this is ideal. And as I look at what has unfolded, I didn't plan on solving this through community support groups, but I'll tell you that my flagship service to patients right now is I just got done last week. So this is my first day of not being in class for 3 weeks, where I lead a 21-day metabolic kick is what we call it, where we are going to improve your metabolism from whatever age you're at. This is exactly what I would need to do if you have a brain injury, if you have seizures, if you have cancer, if you have high blood pressure. This metabolic kick is the foundation for improving your health, your mitochondria, your body.
mm-hmm.
And when we put them in classrooms on Zoom, I lead each classroom at 8:30 every morning. At 9:30, I debrief with all of the coaches, so they have the questions from yesterday answered to go into their support groups. The groups are 5 to 7 people big, or 5 to 10 people big. And after those 3 weeks, they can choose to stay in community with these people who have been trained, because you're not going to improve your metabolism perfectly in 21 days, but you are going to have a roadmap of how to reverse medical problems based on the metabolic health through the education we give you in that class and the community of other people that are educated through that same course with you.
Yeah.
And to me, that's a place where medicine should be growing. You should be finding a way to create a community of community around the problem, and then educate them and keep them in community. And that's weird. That's got HIPAA. What does that do with HIPAA?
Yeah.
Yeah.
Yeah. It's really interesting because those are the bottlenecks, right? That just kind of get in the way of all this. But I know you spend a lot of time on combating chronic disease, and that's a lot of the metabolic repair that you're talking about there. And if you fix that, there's a lot more that can get fixed, right? I mean,
It
we can
truly
look
is.
back at the pandemic, right? That's a whole other podcast, maybe that we could talk about. But the people that were oftentimes hit the hardest were also dealing with some
The chronic,
long-term effects of
absolutely.
inflammation in their body and that sort of
Mhm.
thing.
It's absolutely the summary of that. I mean, when you look at internal medicine, we have terrible marketing. Like, what does that mean? You take care of the inside of the person, but not the outside? No, you take care of chronic problems. And if we do our job well, you don't know what we helped you miss, what we avoided,
Right.
what we said. No, that's a life that's going to be filled with autoimmune diseases and cancer and aging and ill health. And when you look at the how do you fix it? If you think it's a bunch of my prescriptions, you're going to find yourself in the grave with low energy for the 10 years before you hit there.
Yeah. Yeah.
Yeah.
I kind of, again, a whole other podcast probably, but I kind of hate to see all the pharmaceuticals advertised out there because I think a lot of people kind of assume that's the approach. But I love that you take a preventive healthcare approach and that this community approach, which I find fascinating and something I hadn't really spent a lot of time on. in terms of thinking about it. With my own health, I'm really focused on being an advocate for my own health and being educated. I think sometimes I drive my doctors crazy because I've done so much research before I talk to them. But I'm thrilled to hear that you focus on education. I know you even spent some time as a faculty member, so you're an educator, which I love. And I think health education and helping us help ourselves is such a powerful mission.
Yeah, I think what prepared me for being a YouTuber, which my kids think is really great, was the years I spent, being a good teacher. Like,
Yeah.
you want to see failure, try to have a student tell you what you've just tried to teach them, and when they can't give it back to you at all, you're like, yeah, that was me. That was me that just failed there. Watching that education and really honing in the skill of how do you teach a patient, but also the next generation of physicians. It's something I took very seriously. I loved doing it. You could feel that was where I was supposed to be. But much like medicine, when you're in, the academic side of medicine isn't, well, it doesn't pay that well. So when you're independent, you just couldn't do it as much as I needed. I had to give it up. I had to say, you know what, there's going to be a different season for this. And then what happened next was YouTube, really. So that
Yeah.
teaching transferred over into a video.
So I love everything that you're doing, and I love that you're here in Tampa now. So what's next for you, and what brought you to Tampa, and what are you going to be doing in Tampa?
Well, Tom Brady brought me to Tampa. My husband, he turned 50 and he wanted to see Tom Brady play in a football game. So we came and we watched the Chiefs and the Tampa Bay Buccaneers play over Thanksgiving, which turned out to be the Super Bowl, exact same place teams, but the Super Bowl, the Buccaneers won.
Yeah, yeah.
We saw the Chiefs won. Anyway, so it was a wonderful experience. And, it was at a time where there was, the pandemic was really hard on my clinic. My clinic had imploded. I got actually stuck in Hawaii when the pandemic hit for 93 days.
Wow.
And you
Wow.
cannot see a patient even through Zoom if you are not licensed in the state that you're in a pandemic. So that was a heck of a deal. So we ended up home, and I said, if there was ever a time where we were going to move, honey, this would be it. And he said, all right, let's do it. So we ended up in Tampa because of Tom Brady, but also post-pandemic. And, when you push reset and you've had those several trips around the sun of saying, how can I do this better this time around? I've been really trying to find a way that medicine is satisfying to the consumer and to the physician. I think that's probably the most rewarding part of where I've been, is how many people, they don't need to have me as their doctor, but they really do need some really good education about what the doctor is trying to teach you, but only has this very limited amount of time to teach. So I think of some of that education on the YouTube channel as partnering with their physician on, here's what they're doing, here's why they're doing it, and here's what you need to do in order to help them do it better. That's a place where I think the YouTube channel has really grown. My medical clinic is now, I transplanted across the country and could not believe how hard that was. That was probably the hardest thing to keep a finger on the pulse, that I didn't give up on that one. And then there's actually a third company, but I don't know if we have time to talk about that one right now.
Well, I'd love to hear about it. Maybe I need to have you back on. How would that be? I know I've probably taken enough of your time today. I love it. I love this conversation, and I want to learn more. And I think I'm excited to know that there are physicians like you out there. Taking an entrepreneurial mindset, applying it in healthcare. I'd love to see more of healthcare adopt some of the principles of entrepreneurship, which I'm passionate about. I believe they work in virtually any context, and you're a great example of that. I always ask my guests before we close if they have one piece of advice for our listeners, knowing that many of them are aspiring entrepreneurs or practicing entrepreneurs. What would that be? What's one thing? I know you've already given us some really great advice, but
no, I think my advice would be that when you are feeling that pain and frustration, the part that makes you want to give up, that pause, because it's usually right in that moment that you'll see what your passion is. The passion that people see, I get this from students too. I don't know what my passion is. I don't know what my passion is. Like when you feel pain, when you feel frustration, don't run away and say, I quit. Look carefully, because the solution is right there in that struggle. That's where I found mine anyway.
I love it. I love it. That's great advice. Thank you, and Dr. Bosworth. And where can our listeners find Dr. Boz and find out more about your work?
You know what? I think YouTube's the easiest place to land. You can find all kinds of connections off of that channel. But if you type in Dr. Boz on the YouTube channel, you'll land on all my links, and you'll find me that way.
Thank you for joining me. And I'm sincerely would like to have you back in a very short term and share more about what you're up to here in Tampa and beyond.
I would love it. That sounds great. It's a
Thank
date.
you.